everyone, Dr. Janna Vilen here with Intuition Health. So today's video is supposed to be about low back pain, and honestly it is really hard to make these short, interesting videos about our backs. They are super complicated. We've tried to narrow it down to this kind of single finger approach, meaning so your pain is here, therefore your MRI or x-rays show this one thing, and so we're going to do a very targeted approach to that one area. Unfortunately, that doesn't work very well. Backs are kind of, we talk about them as being a functional unit, meaning that all of these structures, so we have the spine bones that stack on top of each other, you have the discs that are in between, the discs are a jelly donut, so that inner part, soft and squishy, that's what causes these disc bulges, herniations. Part of it's that inside part was never meant to come into contact with the outside world, so it can cause not just, always like the traditional like sciatica where you lose function of that leg or have pain, but it can just irritate areas, it can cause pain. We have fascia, that is a huge structure that's not talked about. And so if you're, having low back pain, which 80% of Americans have had, or, either acute or chronic low back pain, you really need to find someone who can look at fascia, look at the muscles. The muscles are shown on MRI, but are rarely read as far as what's going on. There can be atrophy of them. We can use the ultrasound for certain things. There's ligaments that support the spine. There's the nerves. So a lot of times we need things like a really good physical exam to help guide us. That takes me a while. So the average physician only has 7 minutes with their patient. I think it's impossible. I can't do a 1 to 3 minute video on low back pain, just telling you about it. I don't know how in 7 minutes I could possibly take someone's history, look, do a really good physical exam to be able to use it as a tool to figure out my treatment options, and then use that history and physical to look at prior x-rays, MRIs, even, ultrasound exam. Those things are all tools that help guide us. And a lot of times it's not just treating one structure of the low back, it's treating kind of more comprehensively. Treating the low back, plus we forget about, people talk about SI joints all the time. They're these long, skinny joints. They're not really out of place. A lot of times they might, cause your pelvis to rotate one way or the other, but it's critical. The low back attaches to the SI, which is the back part of the pelvis and the hip. It's how we stand up and how we walk. So we need to be addressing all of these issues and looking at all of them when we're doing an exam and talking to them about their treatment plan for their low back. The other problem is a lot of times it's just these kind of general recommendations and medications, right? So I think there's a lot of stuff we can do. So the do's, going to physical therapy, chiropractic treatment, acupuncture, massage. There's all sorts of complementary and integrative health options. So yoga, tai chi, just moving more. So, but how do you move more without getting hurt? Most people are concerned they haven't used their back properly for a long time. They're weak, their legs, their arms are weak. Something has happened. So getting in with someone who is trained to help guide you how to do movement and how to get strong could be one of the best things you can do. When we talk about back pain, it's, acute, subacute, chronic, but also we have passive and active modalities. The passive modalities, which are a lot of what I talked about when I said, chiropractic, acupuncture, massage, the injections that I even do. Those are passive modalities that someone's doing to you, for you. But the important piece of that is to calm your pain down and help you move better and function better, so you can do all of these active modalities. So those are the things, your strength training, you're moving more. So you need to be thinking about this as both kind of treating the pain issue, but then going into that prevention world of like, how do you keep your back pain from coming back, and having all these different tools and people who can communicate and talk to each other to give you the best treatment plan possible. So the best thing I can encourage you, if you have back pain, is seeking out someone who has the time to do a full assessment with you, the time to talk to you about all your different treatment options, the time to talk to your team members who might be treating your back pain, and helping coordinate care, collaborate together. And that's how we set up Intuition Health, is so we have that time with you, and we have that time to talk to other team members, other healthcare professionals, people you are seeing, to make that proper treatment plan and making sure we're all on the same page.